Yes, I'd be happy to. Good morning, everyone, and thank you for joining us today for this informational webinar hosted by the Department of Developmental Services, or DDS, and the California Department of Education, or CDE. The purpose of this webinar is to provide you with information regarding services and placements for 3- and 4-year-old children who are preparing to enter into the school system. Next slide, please. Okay, so here's our agenda for today. We are going to review regional center information, so overview and programs. We will talk about special education and seamless transitions, inclusion, preschool options for 3- and 4-year-old children, and then lastly, we'll have a live question and answer session. Next slide, please. Thank you. So here's our team for today, our team of panelists. My name is Marcia Okada, and I'm the Chief of Transitions and Partnerships at DDS. And I will go ahead and pass it to Erin Dubey.
Sorry about that. My screen minimized. I couldn't get to my unmute button. Good morning, everyone. I'm Erin Dubey. I'm the Education Administrator in the Inclusion Support Office at the California Department of Education in the Early Education Division. Really happy to be here today and see so many of you registered. I don't want to take too much time with introductions, so I think rather than give you any background on me, I'm going to go ahead and pop it on over. Jessica, do you want to go ahead and introduce yourself?
Yeah, thank you, Erin. Hi, my name is Jessica Losh. I'm also in the Inclusion Support Office as a child development consultant working alongside Erin, and my colleague Kim, who will introduce herself in just a second. Yeah, welcome, and I'm excited to be here to share some information.
Hey everyone, Kim Taniguchi here, working alongside Jessica and Erin. I think I'm going to pass that on over to Alberto.
Good morning, everyone. I am Alberto Orellana, Education Programs Consultant in the Early Childhood Support Unit in the Special Education Division with the California Department of Education. I am so excited about this collaboration with DDS. I see that we have more than 500 participants, so I'm looking forward to this presentation today.
Hey, great. Thank you, everyone. So before we begin, I would like to go over some housekeeping items. To ensure that we get through all of today's information from both departments, we kindly ask that everyone save their questions until the end of the presentations. At that time, you can type your question into the Q&A box, which you could find at the bottom of your Zoom screen. We'll also provide our contact information at the end of the presentation. So if by chance we don't get to your questions, then you can feel free to email us and we'll do our best to provide you with any relevant information available. So we're going to begin by talking about regional center eligibility for children with disabilities and delays. I'll be giving a brief overview of regional centers and regional center programs, including Early Start and the Lanterman Developmental Disability Services Act. I'll also go over recent changes to eligibility for the Lanterman Act for young children. Next slide, please. Okay, so the Individuals with Disabilities Education Act, or IDEA, is a law that makes free and appropriate education available to children and with disabilities and ensures special education and related services to those children. Infants and toddlers ages birth through 2 with disabilities and their families receive early intervention services under IDEA Part C. And in California, that program coordinates early intervention services and is called the Early Start program. Okay, and then children and youth ages 3 through 21 receive special education and related services under IDEA Part B. Next slide, please. So there are 21 regional centers in California that cover different catchment areas. Once a child is referred, the regional centers are responsible for taking the steps needed to determine if a child qualifies for regional center services. Regional center services may be through the Early Start program or through the Lanterman Act program. And anyone can make a referral to the regional center. Next slide, please. Okay, so services across the lifespan. The diagram on the screen is an overview of the different programs that an individual may qualify for. So for the regional centers, there are 3 programs. There's the Early Start, which serves children under 3 years old. There's the Lanterman Act, which can serve as individuals from birth through their lifespan. And a new category of eligibility was added to law that allows children birth to 5 years old to easily qualify for Lanterman Act services. It's more commonly known as provisional eligibility because the child will have to be reassessed by their 5th birthday to see if they qualify for lifelong and ongoing services. And there will be more on this on upcoming slides. 2 programs serve infants and toddlers, you can see in the diagram. So early intervention services are provided through the regional center and also through the LEAs for kids with solely low incidence disabilities. Prior to 2021, there were 2 main programs that children could qualify for, and that is the Early Start program and the Lanterman Act. Next slide, please. Okay, so a little bit about Early Start, or Part C of IDEA. This is a federal grant program that assists states in operating a comprehensive and statewide program of early intervention services for infants and toddlers ages birth to 2 with disabilities and their families. It provides service coordination, an individualized family service plan, or IFSP, and early intervention services. The infants and toddlers ages birth to 3 years old may be eligible for Early Start if they have a developmental delay or have an established risk condition or are considered at high risk of having a substantial developmental disability. LEAs provide these services to children with solely low incidence disabilities. Okay, next slide, please. Okay, so Lanterman Act services. To qualify for regional center services through the Lanterman Act, all of the following criteria must be met. So the individual must be diagnosed with a developmental disability, which is defined in the Lanterman Act as autism, cerebral palsy, epilepsy, intellectual disability, or other conditions that require treatment similar to a person with intellectual disability that is not just a physical disability. Okay, the disability must originate prior to the age of 18, is expected to be lifelong, and constitutes a substantial disability for the individual. And thirdly, there must be significant limitations in 3 or more developmental areas. Next slide, please. Okay, so why did we expand eligibility for the Lanterman Act? The eligibility was recently expanded. There were many reasons for the expansion. One of those reasons is that California identified a pattern of children returning to the developmental services system after exiting Early Start services at age 3. And as a result, they were experiencing gaps in services and regional center service coordination. There was added burden to the families to get reconnected to the regional center services after the child's turned 3, did not qualify for Lanterman, and then some time has passed. The second one is that communities of color were disproportionately represented in the children that return later, sometimes as late as age 6. So it causes delays in diagnosing qualifying conditions. And there's also a risk of misdiagnosis and or not returning to regional centers to receive services at all. Next slide, please. Okay, so provisional eligibility. In 2021, Developmental Services Budget Trailer Bill, AB 136, amended the Welfare and Institutions Code to expand eligibility for Lanterman Act services for 3- and 4-year-olds. This was known as provisional eligibility. And then in 2023, AB 121 amended the Welfare and Institutions Code again to expand this eligibility category to include children under the age of 3. So provisional eligibility is a new way for children who are ages birth to 5 years old to qualify for regional center services under specified conditions. Next slide, please. So here's the criteria for provisional eligibility. A child can be provisionally eligible for regional center services if the child has a disability that is not solely physical in nature and significant functional limitations in at least 2 of the following areas of major life activities, which include self-care, learning, mobility, self-direction, and expressive and receptive language. Next slide, please. Okay, so the services. Children who qualify for regional center services will receive the services based on their individual needs. So children who qualify through the Lanterman Act or Provisional Lanterman Act criteria may also qualify for Medi-Cal benefits through the Home and Community-Based Services waiver. There is a wide variety of services available, and they're person-centered and designed to meet each individual's needs. Next slide, please. Okay, so after the age of 5, provisional eligibility is only available to children before the age of 5. So 90 days prior to the child's 5th birthday, the regional center is required to assess children to determine if the child is eligible for lifelong regional center services through the Lanterman Act eligibility criteria based on an intellectual or developmental disability. If they don't meet the criteria for ongoing regional services at that time, the services will end when the child turns 5 years old. Next slide, please. Okay, and we always welcome opportunities for partnership. So if you know someone who may qualify for Lanterman Act services under provisional eligibility, please refer them to your local regional center. There's a link there, and it can be found on our DBS website. And next slide, please. Okay, so now we have Alberto Orellana from the Department of Education, who will be talking about seamless transitions. Alberto.
Thank you, Marcy. Beautiful job. As I said before, we are so excited about this partnership with DDS. DDS is the lead agency for early intervention services in California, and the California Department of Education is the agency mandated to collaborate with Part C services. In 2021, we had around 50,000 children enrolled in early intervention programs, and 10% of those children were enrolled in our LEAs. So let's talk about seamless transitions. When we were developing this webinar presentation, I did not have a title for this slide, but one of my colleagues suggested seamless transitions. You will ask, Alberto, what does it mean, seamless transitions? We already know that transitions are not easy for adults. For example, when you move to a new house, to a new job, or even to a new country, you will have some challenges transitioning. And when we speak about children transitions from Part C to Part B, is not an easy task. We will have some challenges. We will have some miscommunication. Seamless transition means making transition easy without any interruption, without any barrier, not only for children and their families, but for practitioners, early interventionists, professionals, state agencies, local agencies, and the entire community. When children receiving early intervention services under Part C and they turn 3 years of age, they no longer qualify for Part C services. And many children and their families move on to other community programs, such as preschool. The process of moving from Part C to another program is an important time in the life of children with disabilities and their families. That's the message that we want to communicate today. Local education agencies must ensure that a transition plan is developed in the child's IFSP no less than 90 days before the child turns 3 years of age. Next slide, please. Let's talk about the transition notification. This is a key component in the regulation for Part C. The requirement of notifying the state education agency and local education agency in advance when a child is exiting Part C services and potentially eligible for services under Part B is to provide sufficient time for appropriate individualized planning to ensure that the evaluation can be conducted within the 60-day timeline to complete the evaluation convene an IEP meeting, and discuss the results of the initial evaluation. These requirements necessitate that the LEAs have at least 90 days to ensure that the IEP is developed and implemented by the child's third birthday. The transition notification to the state education agency and the local education agency must include the child's name, date of birth, and the parent contact information such as home, email address, and telephone number, all the demographic information from the family. The transition notification may also include the Part C service coordinator and contact information, as well as the languages spoken by the child and parents to assist the agencies in meeting their child's fines responsibilities. Next slide, please. Upon receipt of the referral from Part C, the LEA must provide the child's parent with a copy of the procedural safeguards notice as required under 34 CFR Section 300-504. If the LEA suspects that the child has a disability under Part B, the LEA must request the parent's consent to conduct an initial evaluation to determine the child's eligibility for services under Part B. Of course, that no child will be evaluated without the parent consent. Next slide, please. Let's talk about early learning and care program and service options. All children exiting Part C should have continuation of services and access to quality education in inclusive settings such as preschool programs, Head Start, childcare programs, and other appropriate early childhood centers. Families should be informed and supported throughout the child's transition experience at all times. It is our hope that state and local agencies should work effectively and efficiently together to support smooth transitions. Now I will hand it over Kim Taniguchi and the Inclusion Support Office in the California Department of Education to lead us through the last part of our agenda today.
Thank you, Alberto. Let me get this slide forwarded. So the National Association for the Education of Young Children, NAEYC, and the Division of Early Childhood of the Council for Exceptional Children, DEC, released a joint position statement in 2009. We would like to highlight a portion of the statement where it states, the defining features of inclusion that can be used to identify high quality early childhood programs and services are access, participation, and supports. So you might be thinking, what does high quality inclusion look like? So access. Educators should provide access to a wide range of learning opportunities, activities, settings, and environments. This is a defining feature of high quality early childhood inclusion, removing the barriers so a child can have access to activities and environments can promote learning and development. And as we well know, a child simply accessing an environment with their typically developing peers does not mean they are being fully included. Adding in participation is key. Participation is when educators provide children with individualized support and accommodations so children with disabilities can participate fully in play and learning activities with their peers. And support refers to equipping all professionals working with children with ongoing professional development and training they need to acquire the knowledge, skills, and dispositions required to feel confident and competent in supporting children with disabilities. Supports also include when educators partner closely with families and work together within a broader community system to implement effective, inclusive practices and specialized services. While these are all key features, supporting the child and family through a mixed delivery system, goes beyond these defining features, and Jessica will now share what this will look like. Jessica?
Thank you, Kim. All righty. So here's another quote, because we just love quotes. But this one is, we're going to highlight, this is taken from a recently adopted joint policy statement from the U.S. Department of Education and Department of Health and Human Services that is so impactful in our field now. Families should not have to choose between remaining in their existing early childhood program and receiving early intervention or special education services after children are identified with a disability. Let me read that again. Families should not have to choose between programs that their child already feels comfortable in with continuity of care to a new program just to get special education services. Research has shown that high quality early learning and care programs can have long lasting impact and can increase school readiness and narrow the achievement gap by half. It has also been shown that it has helped pave the way for parents to be in the workforce. Next slide, please. Thank you. So the gold standard is what we call it, and it is when a child with an IEP attends preschool of choice and specialists work with the child and teachers to support the child's access to learning opportunities and participation in all classroom activities, therefore minimizing disruptions to the child and family. So what do we mean when we say by disruption? Here are a couple examples to help clarify. So a child attends a child care program that the family loves. Maybe it might be a California State preschool program or other center-based organization, but then the child is discovered to have a disability and found to be eligible for special education services. Now the family has to leave the original program to attend the special education program offered during the IEP meeting, like a special day class or appointment-based services or TK. Another example is a family needs full day childcare, but the school district only offers a part-day early childhood program. The family must piece together two programs and transition the child in the middle of the day from the school district program in the morning to another program in the afternoon. Oftentimes, transportation isn't provided if the other child care program is outside of the district boundaries. Note that all of the programs the child is in may be a program with same age peers, but the failure to consider the family needs results in disruption. By minimizing disruption, a program would be providing true inclusion at the gold standard level. And now I'm going to hand it over to Erin. Thank you. Next slide.
Okay, thank you, Jessica. All right, so I'm going to go over a few of the inclusion program designs that young children may have the opportunity to participate in. So let's go ahead and go over these. And the first one we have is mainstreaming, which is where children with disabilities spend time interacting with peers in a general education classroom for a certain amount of time each day or each week. There's also reverse mainstreaming, where general education students spend time interacting with peers in a special day classroom for a certain amount of time each day or each week. We have a continuum of services, where a program offers a continuum of inclusion with a percentage of children's time, such as 40% to start, spent in an inclusive setting, and progressing to full inclusion. The program supports children in moving through the continuum towards more of their time spent in an inclusive setting that is the least restrictive environment for the child. We also have a co-teaching model where teachers with different certifications, so general education and special education, work together in the same classroom to plan and implement activities for all children. Teachers may co-teach every day or alternate the days in which they lead instruction. We also have an itinerant special education teacher support model, where a program has an itinerant special education teacher who delivers special education services in general education classrooms in collaboration with the general education teacher and other staff. In the general education classrooms with specialized services and consultation, the program serves children with disabilities in a general ed classroom with general education teachers and staff, and children also receive specialized services at the program. General education teachers may have the option of consulting with special ed staff and related service providers to plan individual services and supports for children with disabilities. And we see this happen a lot with Head Start programs, among others. And then for slots reserved, we have program reserves a specific number of slots exclusively for children with disabilities. This is another thing that happens with Head Start programs and also now with our California state preschool programs. So all of these models that I just shared are from the Early Childhood Technical Assistance Center, which you may be familiar with. They have a toolkit for preschool inclusion, and that's where we got all of these ideas and different models. And we are going to share that link at the end of this presentation. And we will also provide the slides via email to the email that you registered for this webinar for. So you will be getting this link as a resource at the end. Next slide. Okay, so what does this mean for your special education programs? First and foremost, we're really excited that California is at the forefront of early childhood inclusion with the new requirement to set aside enrollment for children with disabilities in California state preschool programs. We now have thousands more inclusive classrooms across the state. The recent federal policy statement that asks states to increase inclusive early learning opportunities for all children is really we're really helping to accomplish that with the new requirement to set aside enrollment in our state preschool programs. But we know that our state preschool programs and other programs, state preschool cannot meet their set aside, and other types of programs can't achieve high quality inclusion without the support of their local special education programs. So the Department of Education encourages local education agencies to work with their local state preschool programs to provide inclusion placements in high quality early learning environments where children with disabilities can learn alongside their non-disabled peers with proper support. These collaborative opportunities also benefit both programs and parents alike. And although it might mean revisiting how or where services are provided to children, we think the opportunity is worth the time and the effort. Expanding options for inclusion would help provide more options for parents needing full day care or wishing to maintain continuity of care if their child is already established in an early learning program. And this is important because we've heard anecdotally from the early childhood field that parents sometimes decline services through the IEP so their child can stay in the program they feel comfortable in, or because parents need additional care beyond what is offered in the IEP. And we recognize that family needs don't always coincide with the resources districts can offer, but we hope that this webinar and everything that we've talked about today will spark some ideas around how special education and general education can collaborate to best meet the needs of parents and children. Okay, next slide. I think that is all the content we have for today, but I do see a number of questions in chat and many of them have been answered. So hopefully you've been typing in your questions as we've gone along. And I wanted to just see, let's see, did we clarify the question on 60 or 90 days? I saw that in there, but looks like one of them got answered. I think that was for Alberto. Give me just a second. Did anybody answer that question? I see that it went away, but there's still a question out there about 60 days.
Do you want me to answer that question?
Yes, that would be great. Thank you, Alberto.
Okay. So the 60-day timeline is specifically for Part B. Once the parent has signed the consent for assessment, the LEA has 60 days to conduct the evaluation, convene, finish the evaluation and conduct the IEP to discuss the result of the assessment. The 60-day timeline refers to the Part B requirement specifically.
Okay, great. Thank you. Okay, I am going to go through and just see if we have some questions that can be answered. And we may not be able to answer all of these live, but I'm going to just go ahead and read through some of them. And if we can't answer them live, we can certainly get back to you at a later date. So there's a question about when the LEA or SEA don't show up to transitional meetings, and is there any accountability for that? And I don't know if that's a better question for our special ed division or for DDS, but you may both have comments on that.
Christy, would you like to answer that question?
Sure. So, with that, what the law requires is for them to be invited, and actually for the state education agency or what otherwise known as CDE, we just need notification of that, and not to be invited to the actual meeting. So there is no actual elements that would require any compliance issues or such, because it's an invitation for a meeting. Best practices are that the LEA would attend the meeting, though.
Thank you, Christy. Mary Chris, I see that you're typing an answer to a question. We have a couple of questions in here about provisional eligibility, and I wonder if somebody from DDS could possibly maybe answer those live. So there's a question that looks like, Mary Chris, you may have just answered the other one because it just popped out of my view. But are provisional eligible children under age 3 able to apply for the DDS med waiver if they meet the waiver level of care requirements? Is there anybody from DDS that could respond to that?
Yeah, I can respond to that, Erin. Just a second. So that expansion, we got approval from the Federal Centers for Medicare and Medicaid Services. So any child ages 0 to 3 or ages 0 to 5 who meets the level of care and all the other waiver requirements can apply for that HCBS waiver. Every regional center has a team that is very familiar with the Medicaid waiver, and so they can help the service coordinator and the family get more information on that. But that is actually one of the things that we're so proud about and happy to share with our community, that children 0 to 5, if they meet the HCBS waiver requirements and also the provisional Lanterman eligibility, may be able to get access to full scope medical through that waiver.
Okay, great. Thanks, Mary Chris. I think that answered a couple of questions that we had lingering in them in here. Is there a clear direction of how to determine substantial for provisional eligibility for children specifically that are birth to 3? I don't know if you touched on that or if you have anything else you want to say about that, Mary Chris, or anybody else from DDS.
Sorry, Erin, can you help? Can you repeat the question?
Yeah, it's asking, is there a clear direction of how to determine substantial for provisional eligibility for children, specifically children that are birth to 3?
Yeah, so we haven't issued any prescriptive direction from the department. And at this time, actually, each regional center has, even before this expansion came to be, each regional center has their own process for how to determine that eligibility, how the child meets the requirements, or what is called substantial disability. But we defer to them in the law as is written, but we're working with key staff in the regional center to come up with more guidance so that it's more consistent and less confusing, not only for our regional center staff, but also for the families.
Thank you. We have another question here for DDS. How does DDS ensure that regional centers are providing services through provisional eligibility? To my knowledge, our regional center does not provide it.
Thanks, Aaron. So we actually look at the data to see how many children are qualifying for this new provisional eligibility and also the services that are being utilized. There is a difference between what the child getting service who qualified through provisional eligibility. I mean, the nature of their services may differ from the nature of services that a child who has qualified for Lanternman. It's all individualized, but at a high level in DDS, we just look at data and make sure that, every regional center actually has children who qualified through provisional Lanternman. Those children are getting services. And I would also note that it's still fairly new. I mean, even though provisional Lanternman has been enacted in 2022, we're only a few years in implementation, and it was only last year that it got expanded to include children 0 to 3. So we're still at the early stages of really verifying that everyone can access the new program.
Okay, thank you. We're getting many, many questions in the chat. So I'll just ask all of the teams on the call to maybe go ahead and take a look at the questions that are in the chat. Some of them may be able to be answered in writing here in the webinar. So I'm just trying to kind of come through and see. This one I think is pretty quick. A child who is turning 3 in the summer, can they receive IFSP, services until school starts? Mary Chris, can you answer that one about a child who turns 3 in the summer? Can they continue to receive their early intervention services until school starts? Or do they need to transition at 3rd birthday?
Yeah. So the program ends at age 3, and this is actually why we have partnerships with CDE, and we want the local programs to partner too. When the child exits early start, the IFSP services cannot continue. So there's more planning that needs to occur for any child who's going to turn 3 in the summer months to make sure there's no disruption in services.
Thank you. I think, let's see. Is the regional center required to provide a draft of the transition IFSP and or current developmental levels to the LEA prior to the transition IFSP meeting? Some districts are requesting that. So somebody has a question about if that's a requirement or not to provide that prior to the transition IFSP meeting.
So we can provide the 3 data points when we make a referral, but we will need parent consent to allow the regional center to release all of that information to the Part B or the special education, the school. So they're not required to share all of that information. They may if the parent allows, but it's not a requirement.
Okay, thank you. Let's see, I'm going to ask you, Mary Chris, to answer one more, and then I'll try to flip to someone else. I know you've been answering a lot of questions here. Can you provide an example of the difference between a child in early start that is status 2 versus PE versus traditional early intervention based on delay? What is the difference in service access?
Thank you. And that's actually one of the things that we're really trying to clarify and develop guidance so everyone could understand. A child who's 0 to 3, who is in status 2, we call it, the Lanternman eligibility, they already meet all of those criteria that Marcy went over. They have a diagnosed disability. The IFSP team and the multidisciplinary team were able to diagnose how that child meets the functional limitations in 3 areas. the child who has provisional Lanterman eligibility might qualify even though they're under 3 if they have more than 2 limitations in the areas that Marcy went over. Early start is really the easiest to get in. If you have a delay in one area, one of the domains, you could qualify. So it's almost a hierarchy, and we're going to work closely with the regional centers staff to make sure that it's easier to understand, but that's how we have envisioned it and how we have tried to describe it in statutes, but more clarification and guidance will come. So going back to, for example, what I think somebody said, asked for an example, Aaron, if you have a child who only has speech limitations or maybe only one delay in one area, that child will qualify for early start. If they have 2 functional limitations, maybe they have delays in speech, delays in, what was the other one? One other area, they may qualify for provisional Lanterman. And then if they already have a diagnosed disability, they may have cerebral palsy and then 3 more limitations, they can meet Lanterman eligibility or status 2.
Okay, thank you. Let's see. There is a question about publications on transition from early start to Lanterman and Part C. I think we do have some transition resources that are at the going to be on the slide that we're going to provide you and that we will send out. So there should be some transition resources in there. I think we could probably have another hour webinar on the follow-up questions for DDS. We do have quite a few in here. I wanted to ask, I think we need a little more clarification, but there was a question in here regarding Part B services, I believe. Let me see. Sorry, I lost my spot here. There are so many questions. There's a question regarding, so it was, is there any way to have Part B support within private schools that are located within the school district catchment area? And I was going to see if Christy could answer that. Sounds like she might need a little more information. I don't know if I see participants with hands raised. Can we unmute people to speak, or I could ask if somebody could maybe type in any additional clarifying information so that we can respond to that question. Or I don't know, Christy, if you want to just, if you feel like it's relevant, mention the newest guidance that came out regarding private schools.
Yeah, thank you, Erin. I think just a little bit more information is needed on it. Because I'm curious, are we speaking of a student who has already gone through the assessment process? Are we speaking about a child who is suspected of having a disability? So there's kind of a range there. But I can speak kind of to both of them and maybe cover both of that. There is in federal and state regulations and code something called Child Find, and that's that a LEA has to actively seek to find children with disabilities, and if a child is found and determined that there's a possible disability, then assessments must be completed. So if a child is assessed and the IEP team determines that the child does have a disability that requires special education services, the team must discuss the services, which includes the setting. So there's many different layers to this piece too with the private school. But if a child is determined to need services, it could be through either an IEP or an ISP. And again, this is individually based. So a child can receive services in a private school, but more information would be required to kind of determine some of those nuances in there.
Okay, great. Thank you. Let's see. I really like this question. I think it's a good one. Do we have any gold standard regions where LEAs and regional centers are close to seamless transition? So looking to spotlight any particular areas or districts where there's a really good relationship between LEAs and regional centers. And so I'm going to toss that out to any of my colleagues who might have any really great examples. And if not, it sounds like something that would be really helpful to highlight, and perhaps another follow-up webinar where we can highlight some partnerships that are working really well, where the transition is really seamless for kids and families. Anybody have any examples?
Erin, I can speak about that. We do have guidelines in California Code of Regulations, Section 17 requires that regional center must develop interagency agreement with the LEAs. The interagency agreement is a good exercise for communication, clarify goals, objectives, clarify services between the two agencies. And I would say that most of the issues that we have transitioning can be clarified at the table when there is clear understanding and communication between the parties. When I was working for early Head Start and Head Start, I remember developing interagency agreement with the regional centers. And many times we clarify issues and we overcome challenges by having those interagency agreements in place. So it is critical to start a good communication by developing those plans. And we do have guidelines on how to do that. So the citation is CCR 17.
Can I further that a little bit too? One of our CDE's technical assistance providers is CalECSE. For the interpreter, it's CALECSE. And CalECSE has some different areas they really highlight in different areas. And CalECSE has highlighted for interagency the San Diego Regional Center, along with the East County SELPA. And anybody who wants can go to their website and get a little bit more information on it and more information kind of on their collaborations, and reach out to them to get some best strategies for that collaboration.
Thanks, Alberto and Christy. That's really helpful. And again, I think that could be a great future webinar where we bring in some local partners to talk about their successes and any road bumps they've had in terms of creating seamless transitions and sort of how they've overcome any challenges that they've experienced. So we'll definitely keep that in mind. I've seen a couple of questions. This is for DDS regarding natural environments. And what natural environment is considered to be for our birth to 3 kiddos. So does the early intervention need to take place in the home unless the parent works where it can be done at daycare or preschool? I will say that as an early interventionist myself, many years ago, I did provide early intervention services within other settings aside from the home. If the parent wanted the home, then that was where we met, but also did see children in their preschool environments, and even accompanied parents to different places to sort of help them with routines and things, and in public spaces that might have been difficult for that child, and just giving them strategies on sort of things they can do to keep their kiddo busy and calm and engaged and feeling included. So that was something that I did in the past, but it sounds like there may be some regional centers that are saying that it needs to occur in the home. And I don't know, Mary Chris, is that something that you have any further comments on regarding natural environment?
Sure, and I'll defer to Erin can clarify.
Natural environments are not only the home settings, it's also community settings.
Okay, wonderful. So that sounds like something that maybe needs to be discussed with the regional center. I did see a couple of questions just regarding further questions that maybe were not exactly related to this webinar, or maybe there are follow-up questions. And as we close out and we finish up here today, we are going to provide you with contact information for the Inclusion Support Office at the Department of Education, also for our early childhood unit at in the Special Education Division, and for DDS as well, and our Early Start partners. So we will provide you with emails where you can email additional questions. We will also keep these questions, and we can use them for future webinars. So apologies if we did not get to your question today, but there was a lot of interest in this webinar. So we will definitely look at what other guidance we can provide in the future, or other types of webinars, and getting out additional resources on this topic. So these are the resources that we will, that are included within the slide deck, and we will email the slide deck. So if you registered, this slide deck will come to you via the email you used to register for this webinar. So we have a number of different resources regarding family resource centers, regarding eligibility, regard the one that I mentioned from the Early Childhood Technical Assistance Center. They have a lot of great resources. We've got a preschool inclusion finance toolkit. So there's a ton of great stuff there. And so we will be sending this out to you, so you will have this information. And then can we bump to the next slide, please? Okay, so this is the contact information that I was mentioning to you. Like I said, you will get the slide deck emailed, and we will send a link out to the recording of this webinar. So you will receive that as well if you registered, and you can share that link with colleagues who were unable to attend. But if you want to take a picture of the slide right now because you want to get your question out more quickly, these are the emails for the Inclusion Support Office at CDE, for DDS, and also for our Special Education Division at the Department of Education. So go ahead and note that. And then we also have a survey. So if you've got your phone out, or if you don't, you can grab it. You can scan that QR code. And we would love it if you would complete a short survey that will help us plan future webinars, and get you all of the information that you need. We really are here to support and to help you with collaboration and just understanding all those regulations. There are many. So please, we would appreciate if you would just take a few minutes to go ahead and scan that QR code and respond to that survey. And I think that is just about all the time we have. It's 10:59. Thank you so much for joining us, and look for future opportunities to get more information and learn about all kinds of things, inclusion and transition. And again, we appreciate you being here with us today.